Hi there, my name's Tristan and I'm the founder of Harley Academy. So I moved into aesthetic medicine relatively early on in my career as a doctor. I was originally working in emergency medicine and was working as a middle grade before deciding to pursue aesthetics full time. So I was working as a junior doctor on the wards, and one of my senior colleagues came in to the doctor's room and was telling me about a course that they'd been on in Injectables, and just telling me a little bit about this whole new world I knew nothing about. And very quickly I became fascinated by the idea of aesthetic medicine and started to research it, and that was really the trigger for me to find out more about aesthetics through one of my senior colleagues. So I think as healthcare professionals we're quite fortunate because we can do a sort of transition into aesthetics. We don't have to take the full big scary leap of going full time. And so for me, I was very fortunate. I could work as a locum, so I could do A&E shifts whilst I was building my patient portfolio, whilst I was undergoing my further studies in aesthetics. And it was around 2015 that I decided I had the ability to take the full leap into full-time aesthetics. So early on in my journey, I was reading about the Health Education England guidelines that were going to try and improve regulatory standards for aesthetics in the UK. And this was a follow-on from the Sir Bruce Keogh review in 2012. And I attended a Health Education England summit in 2015. And that summit was really a really eye-opening moment for me because I could see the way in which the landscape was moving towards qualifications for injectables, for example. And it was from then that I realised that actually there is a pathway that is forming, and this is how aesthetics education could be done. And that was really how I started to think about how to develop this level 7 qualification. So the Level 7 came about from me studying these Health Education England recommendations for how injectables should be taught. And it was very clear that in order to proceed on to learning botulinum toxin and dermal fillers, you had to have a Level 6 bachelor's degree, and then there were going to be these postgraduate qualifications that were developed. And the idea was that you could access those through universities or through Ofqual-regulated awarding bodies. And so in 2015, I got to work thinking about how to create the first Ofqual-regulated Level 7 qualification in aesthetics. And I spent the following 18 months researching and writing this specification with one of the awarding bodies, alongside doing my own postgraduate diploma in aesthetic medicine at the same time. And that became the foundation of our Level 7 qualification. So the qualification that we're offering at the moment at Harley Academy is a Level 7 diploma, and the original version was actually a certificate with a different awarding body. And over the years we've learned how to create an overall better student experience, to optimize the assessments for our learners. And so we're really on our second major iteration of the Level 7, and we think it's in a really great place, which is a balance of academic rigor and also accessibility and feasibility for trainees who are also in full-time NHS work typically. To run a Level 7 qualification in a regulated, independent way, you have to be Ofqual regulated. And what that means is Ofqual, the government's regulatory arm for education, oversees an awarding body, like an exam board, that ensures that each of the training centres, like us, are delivering qualifications to the exact specification. So it's not us that set the exams, it's not us that determine the exact specification, it actually gets externally moderated by our awarding body. So becoming Ofqual regulated was essential, and that was the first milestone that we achieved in June 2016. Throughout the process, we've maintained very close conversations with the JCCP, and it was very important to me to make sure that everything we were doing, all of the studies that our trainees were doing, was future-proof. And that's why becoming JCCP approved means that we're absolutely mapped to the latest standards that are needed to meet these qualification requirements for aesthetic practice. So I think for graduates of our qualification, I'm very pleased to hear really good stories about how their qualification has enabled them to get jobs in clinics, to help them separate their brand from competitors, for example. I think that, you know, as a prospective employer looking for an injector to join their clinic, someone who has a qualification in injectables immediately gives the assurance that someone has a standard of safety and understanding of aesthetics. They haven't just done a basic one-day course, for example, but also that they've done enough cases. So part of the criteria for our level 7 is you have to have seen at least 40 patients, and that is really a solid foundation to then build on. And you know that if you're employing someone with a level 7, they've got those fundamentals, they've had one-to-one training. And so I think having a level 7 sets you apart. I think it prepares you for future regulatory changes. And like I say, I hear really good stories from our graduates who have achieved a qualification and then gone on to have very successful careers. It's really important when trainees come onto our qualification that they know what they're getting in for. So the main reason a healthcare professional will choose to do a level 7 with us is actually for the intensive hands-on practical training that they achieve. And when they attend their clinics, for example, they really do get this one-to-one hands-on experience. But they have to be aware that there's also a significant theoretical and assessments aspect to that. And to be honest, we have such a wonderful student support team that makes sure that our trainees are catered to and supported throughout their journey, that it's never a huge shock. But there is a literature review, there is a multiple choice question, and there is a logbook to fill up. And sometimes that takes a little longer than our trainees expect, but we always get there in the end. So when we asked our prospective students what they wanted most out of the course, it was always hands-on practical training. And there's no good giving all the theoretical academic aspects of a qualification unless they can also become proficient injectors, because that's really what they're here to learn. And so the only way for us to do our training was to deliver the highest quality hands-on injectables training. And the way we do that at Harley Academy is that it's always one-to-one. So you'll join us in clinic and it's your job to run the clinic. So we provide you with all the patients, all the products, the insurance, and you're there treating those patients and sometimes not treating them. It's a consultation which then leads to a treatment plan, which then leads to treatment. And of course, throughout the whole process, we provide you with one of our fantastic trainers, one of our clinical supervisors who are there to make sure that you're practicing safely and giving you tips on your injection technique. And that is at the very heart of the qualification, and there's no other way to do it to get the best outcomes for your training and for your career. Okay, so let's talk about career pathways. I typically say there are 3 ways in which injectors can get started. Number 1, they are completely self-employed. They decide to start a brand, and perhaps they've got a bit of budget available to invest in a premises, take out a lease, start a clinic. And this is when you're going to be doing your own marketing and capturing your own patients. So number 1 is quite an ambitious first step. What you may prefer to do is options 2 or 3 initially. So option 2 is that you become a provider to an existing site. So for example, if there's a Medi-Spa or a place where there's lots of relevant patients that are coming routinely for other services, you could then offer injectables, you could offer other aesthetics services, and they do the promotion for you, and you end up with a weekly list of patients, for example, and then typically there would be a revenue share for the revenue that's generated in that appointment. And finally, option 3, which is probably a really desirable one for most injectors getting started, is to get employed. And if you get employed, then you're going to be working for one of the big clinic chains, or perhaps a really prestigious independent clinic. And with that, you get all of the benefits of the ongoing training and the support, and it's much more like your usual NHS work. But these are really competitive posts, and so there have got to be ways in which you try and stand out. And the best way to think about it is, if you're an employer, what would you ask your prospective employees to have? Perhaps it's really good patient manner, perhaps it's lots and lots of experience, perhaps it's a level 7 qualification. And so if you can't get a clinic job straight from day one, don't let that put you off, because the market is growing and there are many, many jobs available for good injectors. Let's talk about the future regulatory changes that we think are happening. I think the first thing to say is really important is that we don't know the exact specification that the government will use for licensing, but it's very clear that local authorities will be licensing both the premises and the practitioner, and there will be an agreed education standard. And we believe that that future standard will still be mapped to the original Health Education England guidelines that were put forward about 7 years ago. So what does that mean? It means that for us, we're going to continue providing the best quality level 7 qualifications available. And this is for healthcare professionals who already have a level 6 bachelor's degree, who can then do postgraduate education to the level 7 standard. So timelines for when all of this is happening. In 2022, the government are going to include in the new Health and Social Care Act some requirements for licensing, but that doesn't mean that it's going to be perfectly clear from this moment onwards. There's going to be a 2-year consultation window where specialists and the public are consulted as to defining this final education standard. So we think in another couple of years there will be absolute crystal clarity on the precise education standard that everyone has to get to undergo licensing. What does this mean for practitioners who are already experienced? Do they need to do a qualification? There are 2 options available. Number 1 is you can still get the full qualification, the level 7 diploma, and you can get that through a university or through an Ofqual-regulated route such as ourselves. There's also something called the JCCP fast track, which is a non-qualification route, which gives practitioners with 3 years experience a process by which they can pass an exam to get an equivalent standard to what we believe is this future licensing requirement. But in that process, you don't actually get a qualification in injectables. At Harley Academy, we offer our full level 7 diploma, we offer our level 7 fast track, and we offer the JCCP non-qualification fast track. So I just want to talk about the difference between the first 2. You can enroll onto the full level 7 diploma if you're brand new to aesthetics and you want a really structured pathway to get your experience up. That includes all of the mentoring, all of the assessment, all of the shadowing, and of course all of the online learning and support. If you're already experienced and you want to get a qualification, the level 7 diploma, then you can do the level 7 fast track, and that will require you to submit a portfolio of evidence and then sit the assessment components of the exam. At Harley Academy, one of our key philosophies has always been skin first. We want to offer our patients the least invasive treatments before moving on to, for example, injectables and other treatments. And so we have at Harley Academy our cosmetic dermatology program, which is often done in combination with our level 7 for injectables. The cosmetic dermatology program isn't accredited, it's not a qualification, but it's a really structured pathway for healthcare professionals to become experts in this cosmetic skin science, the cosmetic dermatology aspects of routine aesthetic medicine. So that includes topical skincare, it includes chemical peels, it includes mesotherapy and skin injections, it includes microneedling, and it includes an enormous amount of dermatology knowledge on top. And that's delivered through some practical sessions and some online learning. And for practitioners who have combined their skin knowledge with their injectables knowledge, they're generally very holistic practitioners that can start treating a huge variety of aesthetics concerns straight from day one. Harley Academy was based around delivering postgraduate qualifications for aesthetic medicine. So the idea was to build a brand, build a medical school around qualifications for aesthetics. So which came first? Probably the qualifications and then Harley Academy. Really, this is a business question, and when you're thinking about starting a business, you've got to look at the biggest problem you can solve. And clinics solve some brilliant problems. Obviously, there are lots and lots of patients looking for great care, great aesthetics practitioners. I think the real big problem that I saw very early on was that training and education was done very poorly in aesthetic medicine. And so that was the problem that I wanted to tackle first. One of the interesting things about creating a level 7 specification and getting it recognized by an Ofqual-regulated awarding body is that you don't own that standard. So when we created this original specification, it was then immediately available for lots of other training centers to adopt, which of course is absolutely fine. We've focused at Harley Academy in delivering that original standard to the very highest quality we can. And so I'm very passionate about the actual delivery of that standard. I'm very passionate about the practical training we can deliver for our trainees at our academy. And that's why Harley Academy is a large training centre of our own, alongside creating this level 7 standard. I think the first thing to say is there's lots of great training providers out there. There are universities where you can get your education from. There are other training centres. At Harley Academy, I think our big focus is on the quality of the experience for our trainees. This is the feedback that we hear time and time again. It's a very personal approach. We have a dedicated back office team of 25 people that are running the exams, running the student supports, working on our online learning all the time, for example. I think a big differentiator is our one-to-one training. So you're always going to be treating your own patient. You're not sharing models. And I think that's one of the big concerns that people have when they're thinking about where to choose training, because you want as much hands-on experience as possible. We're also very well recognized and accredited by the different bodies, manufacturers, and we have fantastic relationships within our industry as well. At the outset, I was just entirely focused on creating a qualification for injectables that worked, that was practical, that could actually be run in a scalable way. And I think over the last 5 years, we've managed to achieve that. And I'm really proud of where Harley Academy has got to. And I think we're very fortunate to have a very strong position within our field. And the future for us is to really lead on this licensing that's coming in, to make sure that as many practitioners are safe and qualified for when future licensing is required, and to continue to innovate and develop new standards for aesthetics practice. I think the patient demand informs where aesthetics is going, and sometimes that we lose control of that, and you see trends dictating how practice is delivered, or you see some fairly toxic influences, for example social media and reality TV, determining where aesthetics is going. But I think we're kind of getting a handle on that, and I think we're becoming more aware of the kind of pitfalls that the industry has fallen into. So I think patients will always determine where the industry goes. Right now, there's a huge focus on injectables because you get these immediate results and consumers are very demanding. I think as they become more educated and as we become more educated, I think we will move towards more regenerative treatments. I think that the idea of injecting something that only has a volumetric change isn't going to be enough. I think we're going to want to biostimulate and actually regenerate tissues in our practice. I think we're also going to become a lot more holistic. I think injectors that are doing back-to-back lip treatments are going to fall behind, and I think that patients will demand clinicians that can talk about skin and devices and injectables all together. There's also the unknown factor. There are new technologies that are emerging all the time that stand to possibly disrupt aesthetics entirely, and we can never discount that, and we can never see where that's going. I think it's a really exciting time, and I think the future will get better and better for aesthetic medicine. One of the most important things at Harley Academy is that we've got to stay on top of the changes in the sector, and that doesn't all just fall on my shoulders. Fortunately, we have a really strong medical advisory board and full-time educationalists working in our team, and that means that we're constantly looking at the literature that's coming out, constantly working with the manufacturers and staying abreast of all of the developments that are happening so that our trainees can get the latest of aesthetic medicine when they train with us. My top tip for any healthcare professional looking to start in aesthetic medicine: don't build your brand around yourself if you can avoid it, because that's not scalable. So if you want to start a clinic, if you want to start a brand, it's better to use a new brand rather than your own name, because that's really not what you want down the line, because the more successful you'll get, the busier you'll get, and one of the most popular reasons for doing aesthetics, so I hear, is autonomy. And if you want your autonomy, you want a business that can run without you. So that's definitely one thing to think about. My second biggest tip is just don't give up. We've got a sector which is growing 20% year on year. So the consumer demand for good practitioners is growing so much that we can't possibly train enough healthcare professionals. So please don't be put off if you see a lot of local injectors and a lot of competition, because I promise you the consumer demand is there. And if you work to differentiate yourself, if you work to really become a specialist, which takes time and sacrifice and investment into this career, into studying, then you will be able to stand out and you will be able to build your career. And that just requires a lot of perseverance. It doesn't happen overnight, but I don't know anyone that hasn't worked hard that hasn't ultimately achieved a successful career in aesthetics.